Today, we're going to crack open one of the most powerful and common diagnostic tools in any lab, the urinalysis report. We're going to see how this one simple test can tell us so much, from a basic infection all the way to the first signs of a major disease.
Hey, and welcome to the BioScan Hub channel. If you find this guide helpful for your studies, and I really think you will, go ahead and hit that subscribe button. It's a huge help and lets us know we're on the right track.
So you have to wonder, right? How can this one fluid, something we produce every day, act like a liquid biopsy? How does it give us this incredible window into the body's inner workings, its metabolism, and especially the health of the kidneys? Well, let's break it down step by step.
Our journey today has 6 parts. We'll start with the basics, then I'll introduce you to a real-world case. From there, we'll walk through the macroscopic, chemical, and microscopic exams, piecing together all the clues until we land on a definitive diagnosis. Let's get into it.
Okay, so first things first. The routine urinalysis, which you'll almost always see shortened to just UA, is a true cornerstone of lab medicine. It's a test that looks at the physical, chemical, and cellular properties of urine. This gives us an absolutely crucial snapshot of a patient's fluid balance, their metabolic state, and, most importantly, how well their kidneys are functioning.
Now, to make all this real, we're not just going to talk theory. We're going to solve a case, from the moment the sample arrives in the lab to the final report. So, let's meet our patient and find out what brought her to the doctor in the first place.
Our patient is an 82-year-old female, and she's presenting with a really classic group of symptoms. A high fever, she's been lethargic, her urine is cloudy and has a bad smell, and she has dysuria. That's just a clinical term for painful urination. You put all that together, and it's a huge red flag for a urinary tract infection, a UTI, and you can see the physician's orders confirm that suspicion. Now, this quote here gets at a fundamental truth in the lab. For our case, we're using what's called a random spot sample, but the principle is exactly the same for a 24-hour collection. The quality of your result is completely dependent on the quality of your sample. Any mistake in collection, what we call the pre-analytical phase, can make the results totally useless. Garbage in, garbage out. It's that simple.
All right, let's dive into the actual analysis, starting with the macroscopic exam. It's exactly what it sounds like. We're looking at the physical properties of the urine that we can see with our own eyes. Specifically, we're reporting its color, its clarity, and its specific gravity.
So, looking at our patient's results, the color and specific gravity are technically within the normal range. But look at the clarity. It's reported as cloudy. A fresh, normal urine sample should be clear. This right here is our first major clue that something's off.
So let's break that down. The yellow color, especially with her fever, probably just means her urine is a little concentrated. But the real story here is that cloudiness or turbidity. That almost always tells you something is suspended in that urine that shouldn't be there. Things like a whole bunch of cells or, as we're starting to suspect, bacteria.
And that brings us to specific gravity, or SG. Think of it as a measure of the kidney's power to concentrate urine. The higher the SG, the more stuff is dissolved in it. Our patient's result of 1.020 is on the high end of normal, which makes perfect sense, right? She has a fever, her body's losing extra fluid through sweat, so her kidneys are working hard to hold on to water, making the urine more concentrated. It all fits.
Next up, we move from what we can see to what we can measure chemically. And for that, we use a reagent dipstick. It's like a mini laboratory on a tiny plastic strip. Each of these colored pads is loaded with chemicals that will change color if they detect certain substances, giving us a ton of diagnostic clues really fast.
Now let's focus on the most important results for this case. And wow, look at that! Every single one is abnormal. The pH is high or alkaline at 8.5. We've got a positive result for blood, a positive result for nitrite, and a positive result for leukocyte esterase. This isn't just one clue anymore. This is a powerful pattern of findings all screaming infection.
So, what does it all mean? Well, that high pH can be a sign of specific bacteria that split urea into ammonia, making the urine alkaline. The positive blood, or hematuria, tells us there's inflammation irritating the lining of the urinary tract. The positive nitrite, that's a huge indicator for bacteria. Many of the bugs that cause UTIs convert the nitrate that's normally in urine into nitrite. And finally, that positive leukocyte esterase, that's an enzyme that comes directly from white blood cells, confirming that the body's immune system is on the scene fighting something.
So the dipstick has given us a ton of chemical flags. Our next logical step is to go to the microscope to get visual proof. What we do is we spin the urine down in a centrifuge to pack all the solid bits, like cells and bacteria, into a little pellet. Then we put a drop of that sediment on a slide and take a look under high power to see what's actually causing all those chemical changes.
And the results here are, well, they're dramatic. Normal urine should have basically no bacteria, and maybe 2 white or red blood cells per high-power field. That's what HPF means. Our patient has 4+ bacteria, which is lab speak for too many to count. Her white blood cell count is sky-high, between 50 and 100 per field. Her red blood cells are elevated too. This isn't a clue. This is definitive proof.
The microscope tells the whole story. It confirms everything we suspected. We can literally see the culprits, the bacteria, and we see the body's response, this massive flood of white blood cells, a condition we call pyuria. The diagnosis is now crystal clear. This patient has a major urinary tract infection.
But our job in the lab isn't quite finished yet. The urinalysis told us that there's an infection, but now we need the urine culture to tell us 2 more crucial things: exactly what bacteria is causing it, and most importantly, which antibiotics are going to kill it.
And here are the culture results. We've got significant growth of 2 different organisms, E. coli and Streptococcus agalactiae. That count of over 100,000 colony-forming units per milliliter is the classic cutoff that defines a significant infection. Now, since E. coli is by far the most common cause of UTIs, it becomes our main target for antibiotic testing.
So, next we test that E. coli against a panel of different antibiotics. The S you see next to each drug stands for sensitive. That means the antibiotic was effective at stopping the bacteria's growth in the lab. As you can see, this particular bug is sensitive to a few different options, and in this case, the antibiotic Bactrim was chosen for treatment.
And that's it. That brings our whole diagnostic journey to a close. We started with the patient's symptoms, we used the complete urinalysis to confirm an infection, and then we used the culture and sensitivity report to pinpoint the exact cause and find the right medication. This is a perfect example of laboratory medicine in action.
So, we've seen how powerful the urinalysis was for diagnosing this UTI. But just think about this for a second. What if that dipstick had been positive for glucose and ketones? Or what if it showed a massive amount of protein, and the microscope was full of something called renal casts? That same simple test can point us towards completely different diseases, like diabetes or kidney failure. And that is the true diagnostic power that's hidden inside every single urine sample.